So my name's Adrian Singh. I work for the Institute for Urban Digital Health as a podiatry team leader. So my role is to essentially coordinate the podiatry program for South East Queensland. So we cover a fair region, and in that region we have about 6 to 7 podiatrists working at any one time. And the program itself started around 2012 and then kind of increased due to demand of the program.
I think we've been in a really lucky and privileged position to be able to interact with Aboriginal and Torres Strait Islanders and provide them with care that they haven't previously had access to before, and work in Aboriginal medical services where they're really focused on building engagement and kind of like support and a really good rapport with those patients in those clinics, and just building that trust and that familiarity with getting into a really good cycle of care through the GPMP cycle of care and the Institute's social model of care, and seeing both them and then their family members come into the clinics and stay in those cycles of care and get put into the correct allied health stream as they need to help them manage their chronic diseases. And I think from our podiatry point of view, with the high incidence of diabetes in Aboriginal and Torres Strait Islanders and preventing those foot complications associated with that has been really good.
We needed to find a supplier who could supply these things, so we've created an alliance with My Foot Doctor, who supply all our footwear, orthotics, shoes, and provide specialist services for patients who may need more care that we can't provide on site in the community control settings.
We have a really strong relationship with IUIH, both in terms of their assistance with bulk footwear and orthotics for their clinics, and also creating a referral pathway for their complex needs patients. For those patients requiring specialised services, we typically receive a referral from the podiatrist. They've triaged that patient as requiring specialist assistance, either in prosthetics and orthotics, or pedorthics in custom footwear, or specialised orthotics and shoe modifications. That referral comes through. We're generally able to see them within 7 working days of that referral, and upon receiving acceptance of our quotation of services, we're able to deliver that within 14 days.
From having that patient walk in the door with, chronic or debilitating pain, and also urgently needs offloading, we are in a fantastic position where we can liaise with My Foot Doctor, put that urgent order through and make sure that we get those products to the patient, usually within that 7 days.
So Mark's here. Mark had a stroke in October 2010, and it affected the right side of his body, his arm and his leg. Basically has no muscle power from the knee down, so just try and lift that foot up against resistance, mate. Nothing there at all. This means that he walks with his foot over on the side and it's dropped down, making it very difficult to walk. He has an ataxic gait, which means he's very clumsy, basically. We were able to make Mark a pair of shoes with a brace up the back of his leg, an ankle foot orthotic, which was able to hold him in a better position. And after that, we were able to make him a custom-made boot, which has internal bracing, which holds his foot up at right angles, and it's wedged inwards to stop his foot from rolling over. Mark had routinely had many falls before he came to see us, and in the last 6 months he's not had one fall. Have you, mate?
No, it's been good.
Good stuff.
The new shoes have changed my life, and walking. I can walk a lot better and a lot quicker. I used to walk to the shops, take me 15-20 minutes to get to the shop, and probably a fall. But now I do it in 10 minutes.
Seeing those patients where they haven't had appropriate footwear, they can't afford to buy appropriate footwear, and have foot deformity or any kind of biomechanical issues that are putting them at risk of foot complications, and being able to give them a pair of shoes that makes a really big difference, and put a pair of orthotics in their shoes that help support them and reduces their pain levels so they can get back to work or playing with the kids more on the weekends and their grandkids, and just improving their daily quality of life with simple things like orthotics and a pair of shoes.